Good afternoon, ladies and gentlemen. On behalf of Jim Tokus, National President of the Canadian Council of the Blind, welcome to the Council's World Sight Day Conference 2023 on the current state of vision health in Canada. I would like to take this opportunity to thank today's presenting sponsors. Building public awareness is important to the vision health community, and we couldn't do it without your support. Thank you. The Canadian Council of the Blind acknowledges that our work here takes place on traditional and current territories of Indigenous people across the whole of Turtle Island. On the National Day of Truth and Reconciliation, the Government of Canada shared a visual that illustrates Indigenous cultures. Among the various visual elements, the circle is at the center, which represents being together in a spirit of reconciliation. The visual includes three icons: the eagle to represent First Nations, the Norwell to represent the Inuit, and the beaded flower to represent Métis peoples. The orange color represents truth, telling, and healing. The orange smoke represents Indigenous traditions, spirituality, and inclusion and diversity. The stars represent the children who never made it home from the residential schools. And the pathway represents the road to reconciliation. It's a powerful image that represents First Nations, the Inuit, and the Métis people that reminds us of the Council's commitment to reconciliation. Thank you. Miigwech. Today we are privileged to have with us a cross-section of representatives of major health stakeholders in vision health, presenting their view of the future in post-pandemic era. Topics to be covered include an overview of the report card on the state of vision health in Canada, challenges and concerns related to eye health from birth to end of life, the pivotal role of comprehensive eye examinations, a report on the access of vision health, the current state of vision research in Canada, and how integrated model of service delivery for vision rehabilitation empowers those impacted by vision loss. How to ask a question. Go to the chat icon at the bottom of your screen. Click the icon. Tap the drop-down arrow and select Send to host the Canadian Council of the Blind. Write your question in the text box, indicate which panelist you wish to answer your question, and tap the blue Send button. You can also use the Q&A tab at the bottom center. Note, if your question is not answered during the broadcast, we will answer it in a follow-up email. She's the MP from Humber River, Black Creek, someone who has long demonstrated an unwavering commitment to public service and has served in various capacities at both federal and municipal levels of government over 30 years. On June 14, 2022, she introduced her private member's bill C-284 entitled An Act to Establish a National Strategy for Eye Care. On passage, Bill 284 will have a direct positive impact on Canadians' vision health now and for generations to come. Ladies and gentlemen, my friend, the vision health community's dynamo on Parliament Hill, the Honorable Judy Sgro.
Thank you very much, Michael, and thank you for that very kind introduction and for having me with you today. It's an honor, as always, to address you give you an update on where we are with Bill C-284 to establish a national eye care strategy. And I have to tell you, we have come a long way since we've last seen each other last year. First and foremost, I want to thank you for your continued support. Thank you to everyone who reached out to their members of Parliament and they spread the word about how important it is and what we all are trying to accomplish for a better vision health care in Canada. As you may remember, I first introduced Bill C-284 in June 14, 2022. My fellow parliamentarians were assuring me that there would be a long, complicated process that takes months, if not years, to get a bill through the House of Commons. Unfortunately, they were very right. But in less than a year, with all of the support I got from the Vision Challenge community, we were able to move that along much faster. I was able to move the bill in the second reading this past May, and on June 7th, 2023, the House of Commons unanimously supported C-284 with 324 votes in favor and 0 votes against. That's not too often that we get that kind of a vote count in the House of Commons, as if you notice the way the House tends to go. We also managed to get this bill through the Health Committee during the last sitting week and to make the necessary amendments to improve the bill even further before the summer break. And that again was the last meeting of the committee and the last meeting of the House. So this is an important milestone and an incredible moment for the Vision Health community and for all Canadians. I'm thrilled to be in a position as an MP to truly make a difference by putting forward this bill. The fact that the bill has a cross-party support is because no one in this country can deny the seriousness of the challenge we are facing, and the fact that it has taken so very, very long to get where we are today. Worth remembering that in 2021, the Canadian Council of the Blind, in partnership with Fighting Blindness Canada, the Canadian Ophthalmological Society, and the Canadian Association of Optometrists, commissioned a study on the true cost of vision loss in Canada. That study revealed that over 8 million Canadians suffer from eye diseases. 1.2 million live with vision loss or blindness. There's a high percentage of seniors and school-aged children who have undiagnosed eye problems. Meanwhile, 75% of vision loss cases are preventable. And I think that is the key, is the fact that so much of this is preventable. But it needs research. It means people becoming aware of a variety of different issues and paying attention to their eyesight. As early as 2003, the Canadian government made a commitment to the World Health Organization that they would develop a vision health plan for Canada. That was in 2003. Yet historically, the federal government has lacked any substantive public eye health care framework. The current structure has created huge gaps in access to care, leaving the majority of Canadians to pay for their eye care expenses out of pocket or forcing them to work private insurance packages into their already challenged budgets. My job as a parliamentarian was to make sure that this government is aware of the problem and is ready to develop a comprehensive response, which meant all of us, including the vision care community, were lobbying all members of parliament on all sides of the aisle to make sure they understood the seriousness of the issue and the opportunity that we have before us right now. So I want this bill to initiate an inclusive consultation process where the federal government will genuinely seek inputs from the provincial governments and professional associations to create a comprehensive strategy responding to the concerns of doctors and patients who are at the forefront of Canada's fight against vision loss. So what's next? Well, we have an exciting week ahead of us. The next step is to have the bill debated in the third reading this coming Friday, October the 20th, 2023, at 1:30 in the afternoon. And just to kind of explain it a little bit, after I had the first hour of the third reading, I dropped to the bottom of the order paper, which meant my next day for the debate was December the 1st. And my job was to trade it with other members and trade it up, and it probably wouldn't have got onto the order paper till February. But I approached Richard Cannings, and I'm specifically saying Richard Cannings, he's a member of the NDP party, and he was the one who traded this up because he recognized how important it was. And if we have an opportunity, we should send a note to Richard and thank him so much for doing this, because he's bringing us up at least 2 or 3 months in time. So after this bill will be scheduled for a vote the following Wednesday. So the process is this Friday, I have an hour debate. The debate closes and it's referred to the House for a vote the following Wednesday. So October the 25th, I believe, is next Wednesday at approximately 3:15 in the afternoon. There will be a vote on C-284. It can't be delayed. It'll either be a yes or it'll be a no. And with all of the work that all of your sponsors and all of your members have done, I am fairly confident that it should pass. But if you want to be able to view it, it will be on CPAC at just after 3 next Wednesday. And so I think it will move fairly smoothly through the next stage. And then it goes to the Senate. Once it passes in the House, it goes to the Senate. It'll have to go to committee at the Senate and go through several readings before it will become the law of the land. So we'll have to take your lobbying efforts from the House over to the Senate, but the Senate has asked me many times, when's your bill coming? Because they're anxious to get it through. So we've come a long way, but there is much more to be done. Making eye health, vision care, and rehabilitation services a health priority requires everybody's support. I encourage all of you today to continue being the champions for Bill C-284 in your own communities, so we might all be able to celebrate it as the law of the land as soon as possible. So thank you for the opportunity to participate today. I appreciate it very much. It's a very exciting time. I can't wait for Friday to come and to do this hour of discussion and debate with my colleagues on the floor of the House. And the most important day is going to be next Wednesday, October the 25th, when it gets a vote. And if we keep up what we've been doing all along, I'm hoping for a unanimous vote. And then we will start working on the members of the Senate to get it through there. So to all of you on the conference, I wish you much success this afternoon. And thank you for the opportunity to be a champion for all of you.
Thank you, Judy. And thank you for being a champion for all of us.
It's an honor, an absolute honor.
Now, without further ado, it is my pleasure to introduce a great friend and one of CCB's most important assets. He is the Senior Research Officer at the Canadian Council of the Blind, the past President of Research at the CNIB, and the past Research Director of Blind and Low Vision New Zealand. Dr. Gordon is an adjunct professor in the Department of Ophthalmology and Vision Sciences at the University of Toronto, and was the principal investigator of the CCB study, a report card on vision health in Canada 2021. Ladies and gentlemen, Dr. Keith Gordon.
Thank you very much, Mike, and thank you, Judy, for your great update, and particularly for everything you've done on this really important issue. It certainly could never have happened without you. Those of my age have been working on this for many, many years and haven't got anywhere close, and it looks like we are on the precipice right now, so thanks again. Before I proceed with my talk, I'd like to mention that there is a slide up on the screen. I will be using slides, but the slides are basically for me. I will read everything on each slide, so don't worry about it from an accessibility perspective. So what I'd like to talk about today is to set the scene for today's discussion by taking you through some of the research we have conducted recently. First of all, as Judy Scrow mentioned, we conducted a study on the cost of vision loss in Canada in 2019. We reported that in early 2020, and no sooner had we done that than the pandemic descended, and we decided we needed to take an additional look at what the impact of the pandemic had been on the cost of vision loss. And so we did an addendum to the cost of vision loss in early 2020. Fast forward almost 2 years, and we decided we needed a report card to see whether there'd been any recovery from what was reported for early 2020. And so in 2022, we did a report card looking at an overall status of vision health in Canada using 2021 data. And that's what I'd like to present now, because that forms the basis for discussion of where we are now and where we're going to go in the future. So the findings of our report card were basically, we had 5 major findings. Overall, we found that vision health had improved, but hadn't returned to pre-pandemic levels. So in 2021, things were better than 2020, but we weren't back to where we were in 2019. Not that that's necessarily the ideal, but that's where we certainly would like to get back to. So there were 5 aspects of our findings on this vision health. The first is that progress in eye surgery was happening, but not quickly enough. And I'm going to talk to each of these 5 issues. So the first is that there was more eye surgery being done, but not enough to take us back to pre-pandemic levels. We found that pharmaceutical claims were below pre-pandemic levels. That means that people are not getting the medications that they need to preserve their eyesight. We found that optometrist visits were below pre-pandemic levels. They had increased somewhat compared to 2021, but hadn't reached the 2019 levels. Wait times for eye surgery continued to grow, and funding for vision research was very low and essentially unchanged compared with 2020. I'm going to talk a little bit about each of these findings, but we have specialists in each of these areas who will be talking about it in greater depth and give you a projection of what the future might look like. Okay, so let's look at the issue of eye surgery firstly. We said that progress in eye surgery was happening, but not quickly enough. We found that there were a total of 108,000 fewer ophthalmic surgeries performed in Canada in 2021 compared with 2019. Now that number was not as large as it was in the previous year, but it was still significantly lower than 2019. So surgery was still not being done at the levels that it should be in order to overcome the backlog. We found that the wait times continued to increase. The number of days to achieve 90% of people having had cataract surgery, which is the measure that one measure that you can have to look at wait times, was in 2019, this number was 219 days. In 2020, this had increased to 310 days due to the pandemic. And in 2021, it decreased somewhat to 255 days, but was still not down to the 219 days that wait times took in 2019. Now, to their credit, federal and provincial governments had provided additional funding to address the backlog in order to keep operating rooms open and things of that nature. But we found, as we looked into this in some depth, that we were being told that the main reason that this number is not increasing to the level that is offsetting the backlog was the whole issue of staff shortages. Staff shortages at all levels in hospitals remain a critical issue impacting the delivery of Canadian vision health care. A study conducted by Statistics Canada in 2021 showed that 25 to 40% of healthcare workers are considering leaving their place of employment or changing their jobs. So this creates serious challenge for vision health in the future. If we're going to offset some of the backlogs and provide the ideal vision health in the future, we have to address the staff shortage issue. So that is a surgical issue. The second one is that people are starting to revisit their eye doctors, but not quickly enough. It was estimated that the total number of optometrist visits missed in 2021 compared to 2019 was 1.8 million. It means 1.8 million people were visiting their optometrists for regular eye exams in 2019, and we're not doing it in 2021. This puts millions of Canadians at serious risk of losing vision, and Dr. Spiro is going to talk about this in a little while. 2/3 of Canadians have not had an eye examination within the past year, and eye doctors were reporting that people are presenting in clinics with irreversible vision loss after several years of not receiving eye care. So people are going blind just because they're not being identified early enough by their optometrist, or weren't seeing their ophthalmologist for the medications or treatment that they required. The total ophthalmic pharmaceutical claims in 2021 were 11.7% fewer than they would have been expected if growth had continued at the pre-pandemic rate. So people are not getting the ophthalmic drugs that they need in order to control vision loss, with conditions such as glaucoma, where you need to take regular eye drops, or macular degeneration, where you need regular injections into the eye. It appears that people were hesitant to see specialists and to receive treatments, and this hesitancy seems to have continued through 2021. If you look at the anti-VEGF claims, that's the injections that people receive in their eyes for the treatment of macular degeneration and diabetic macular edema, there were 67,000 fewer in 2021 than would have been expected if growth had continued at the pre-pandemic rate. Now, there was a little bit of, this is not quite as bad as it seems, because the way these diseases are treated leads to slightly fewer injections being used, but nevertheless, it is far fewer than we had expected. And if people are not getting those injections, they are losing vision unnecessarily. So moving on to medical research, I mentioned that we showed that the total funding of all medical research for vision, it's vision research ranging from the type of research that's done by psychologists all the way through to the stuff that's done in the laboratories by geneticists, all the way through to clinicians. The total amount of that research in 2021 was $21.3 million, which is essentially unchanged from 2019. So the 2019 number was abysmal. It was around $21 million, and it's still unchanged 2 years later. And it's if we want to make any headway in vision health in Canada, that number has to be changed. And the people from Fighting Blindness Canada will be talking about that in a little while too. So how did the vision loss community fare in 2021 compared to 2020? Well, at the start of the pandemic, we surveyed people who are blind, deafblind, or partially sighted to assess the effect that the pandemic was having on their lives. And then in June and July of 2022, that's 2 years later, we did a very similar survey in order to assess the impact of the pandemic at this stage of the pandemic. And this is a bit of a good news story, in that we found that the community was under far less stress than it had been at the early stages of the pandemic. People had greater comfort with going out, they were more attuned to social distancing, and they were, in fact, going to visit their doctors and getting vaccinations. In fact, the vision loss community had better vaccinations rates than the general population, in spite of the fact that the government had not given this community priority status in getting vaccinations. They went out and got it on their own. So the community is doing better. There's still a certain amount of stress, there's a certain amount of mental trepidation about the pandemic, but overall the community is doing better. So overall, to bring this full circle, the report card came to the conclusion that what we needed in Canada was a national vision health strategy, which would be essential to provide the best possible outcomes, quality of care, and rehabilitation for Canadians who are blind or partially sighted. And this brings me back to the beginning to thank Judy again for taking this National Vision Health Plan to government. And hopefully, as Judy has pointed out, we will not be very many weeks away from having a bill that mandates a strategy, and hopefully within 18 months we will have a strategy. So thank you very much, everybody. And with that, I would like to pass the microphone or the Zoom over to Dr. Phil Hooper, who is president of the Canadian Ophthalmological Society, who will address the impact of the pandemic and the impact of a vision health loss, or where we are today, and look out to the future from the ophthalmologist perspective. Thank you very much, Dr. Hooper.
Thank you for having me. I'm just going to hopefully share my screen and we'll get underway here. A lot to talk about, and I don't want to spend a lot of time reiterating what has already been said and is going to be said in other presentations today. But I think the important thing about this discussion is to point out that as physicians and surgeons, and that's what the COS represents, we are the eye physicians and surgeons of Canada, and there's about 900 ophthalmologists across the country that belong, about 80% of the eye doctors in Canada, the physicians and surgeons that specialize in eye disease, and about 200 people in training. And one of our key roles as COS is to advocate on behalf of people with vision-threatening disease to try to improve their access to care, timely care, and as well to improve their access to new developments, because there's been a lot going on. What are our challenges? And I think Judy mentioned it first, and that is complacency. We assume, as most people do in the first world, that vision will be good until we die or until it isn't. And it's not a given. The difficulty, and you'll see that in my next slides, is that our ability as physicians to treat many of these diseases is absolutely dependent on getting on board at the early stage of disease. The end stage of disease, very difficult to treat, and the vision outcome is usually not very good. So it's absolutely critical that people have regular eye examinations, and we're not doing that. These eye examinations really need to start from birth and continue to the end of life. And although it's expensive to do all of these things, and with some of the new treatments on board in the next little while, it's going to get even more expensive, but that has to be weighed against the cost of vision loss, as Keith has mentioned. So let's talk about some of the challenges in childhood. Let's first of all start out with retinopathy of prematurity. You may or may not have heard of this. This is a disease that develops in about half of the children that are delivered before 31 weeks of gestational age. Why does it develop? It develops because the baby comes into oxygen in high concentration before the blood vessels have had a chance to fully grow through the retina in the back of the eye, and they grow in place of within the retina out into the center of the eye, basically causing scarring and lifting the retina off. In the past, we had only very destructive treatments for that, and I mean by past, we're talking 15 years ago, so these are very recent developments. We now have the ability to stop the disease in its progress using laser, and the advantage of laser is it's less destructive for the eye. But the key thing that has really changed the ability of this disease to be stopped, because it literally can develop in days. Children are being examined in neonatal units every second day when they're approaching threshold. And We have the ability now to inject drugs directly into the eye that stops this progression and gives us a chance to treat it. Refractive error, it's important, and I'll talk about refractive error, strabismus, and amblyopia sort of as a group. The problem with improper focus of images on the retina in the eye is that it leads to, or can lead to, problems with the eyes competing with each other. And basically, until the child's 11 or 12, the two eyes are competing with each other for what's called dominance within the brain. And if everything goes well, they have equal dominance and you have equal vision and both eyes function well. If they don't have equal dominance, and that happens in about 2% of children, the one eye can be shut out, and even though it's anatomically totally normal, it permanently will have reduced vision. So that is something that needs to be addressed and identified very early, as early as 3 or 4 months. Some of the signs can be developed or can be detected and treated. And the final thing is, children being children get into things like pencils and sharp objects, and that's important from the standpoint you want to prevent these, because our ability to treat a young eye that's been severely traumatized is still very limited. So as we move on in life, it certainly can affect young children, but in the teenagers and on, one of the biggest impact diseases that we're facing now is diabetes. And there is an epidemic of diabetes. It's growing, the incidence faster, way faster than the growth of the population. And our ability to treat the complications of diabetes depends absolutely on our detection of the disease at its earliest stage. The problem is, at the early stages, the person has no symptoms, and that comes back to the eye examination. What does diabetes do? It basically causes a loss of the blood vessel lining, so fluid leaks into the retina, the film in the back of the eye, blurring vision, and it actually causes, with further destruction of the wall, closure of the small blood vessels, which then go on to proliferate or grow out into the center of the eye, where again, like in retinopathy of prematurity, they cause bleeding or can pull the retina right off. In the past, we had the ability to do very destructive laser to control proliferative disease. In the 80s, we had the ability to use laser to treat some cases of leakage, about a 10 to 15% minority. The real development over the last 15 years is the development of drugs, which are very effective at controlling leakage. They don't work instantly. It is a treatment like a treatment for hypertension, not a cure, but very, very effective. They can preserve vision, keep people working and in school, where otherwise they wouldn't have been able to do that. Trauma is again a problem in this age group. About half the eye trauma occurs at home, half occurs in the workplace, and almost 10% occurs in sports. All of this is preventable with the use of the appropriate prevention. And again, the amount of time off work and off school to try to rehabilitate eyes that are traumatized is enormous. Infection and inflammation, I want to talk about because of some of the new developments, both in terms of new drugs to treat infections in the back of the eye, but also new drugs to treat herpetic infection in the front of the eye. Herpes, the cold sore virus, or the shingles virus can get into the front of the eye, and it can cause scarring and vision loss. Our ability now to transplant eyes, corneas, the clear dome that covers the eye, has improved from a very crude technique where you basically took a cookie cutter, took the center of the cornea out and sewed it in, to our ability now to literally dissect the layers in someone's eye while they're alive, laying on the table, and put back just the layer that's needed. So that's been a huge advance. The challenge now is eye donation, and it's important to consider that as you look at your donor cards. The older adult, that's the group that everybody thinks about as needing eye care, and there's no question the chance of requiring eye care is much higher the older you are. About half of us will develop a cataract, which is a haze within the lens that does the focusing in the eye by age 70. The neat thing about cataracts is we have gone basically from the early 1980s where a very large opening was made into the eye. A lens was placed that sort of corrected the vision, but still required fairly thick glasses to give good vision, to the ability now to precisely measure exactly the needs of the eye for focusing and to implant a lens that will restore those needs. So we call it refractive cataract surgery, and that goal is certainly here. The holy grail is to get the eye to focus like it did when you were 20. I don't think we're quite there yet, but developments are coming. Glaucoma is a disease, as you've heard, has its peak incidence in older individuals, but it is the silent thief of vision and can start at any age. And that's, again, the importance of having regular eye examinations to detect damage of the nerve in the back of the eye or high pressure that may lead to this damage. We have the ability to use various drugs, and there are new drugs that have appeared over the last decades to allow us to treat this, but it's a very onerous thing for patients who need to use drugs several times a day, and compliance is up and down. Where the new developments are really showing promise is the use of laser to delay the need of drops in many cases, and in the need of very precise surgery that doesn't create the scarring of older forms of surgery and some of the risks, to bring the pressure down. Finally, macular degeneration. This is the blinder straight ahead. There are two forms, wet and dry. Wet basically is caused by blood vessels growing from below the retina into the retina, leading to scarring. If we catch it before the scarring develops, and that's the key, again, regular eye examinations, early patients presenting early with their problems, we can, in about 80 to 90% of people, stabilize the scar so it doesn't get bigger. But this, as Keith mentioned, requires injections for life. And that's where developments are coming. I think the most exciting thing that's on the forefront, it's a bit scary, but also exciting, is our ability in the near future to treat dry macular degeneration. This is a more insidious type of disease in which you lose vision in bits and pieces. So it drives people crazy when they're reading because letters disappear in and out. People's faces disappear in and out. It's very, very frustrating. And up to this point, it progressed even when we treat the wet disease. In the near future, we will have drugs that will at least slow down the progression of these dead areas in vision. But again, very rigorous and onerous treatment regimens. So in summary, eye examination, you have to lead the horse to water and make it drink. And unfortunately, in Canada, we're not doing such a great job at this. We have to coordinate better at all levels of the patient care stream between family doctors, pediatricians, endocrinologists, optometrists, ophthalmologists, opticians. We need to streamline and develop better ways of communicating and moving patients back and forth to avoid delay. But the good news is, if we do all of that, we potentially can stave off vision loss, hopefully, for the physiological lifetime of our patients. And with that, I thank you very much for your attention.
Thank you very much, Dr. Hooper. It was a wonderful, but too short overview of all of the issues that we're facing in vision health. And I love your optimism that you finished with about the idea of us outliving our eyes. A colleague once who used to say the trouble with people losing their vision is that our eyes are not lasting as long as we are. But I think what you're saying is that, sorry, and I said us outliving our eyes. Our eyes should outlive us. And that's the hope that you've presented to us today. So thank you very much. I would like to move on to our next speaker, who's Dr. Martin Spiro. Dr. Spiro is president of the Canadian Association of Optometrists, who will give us a slightly different perspective on the issues facing us in vision health today from an optometrist perspective. Thank you, Dr. Spiro.
Thank you so much. It's really an honor and a pleasure to be here in this great example of collaboration to advance this. And I really think that, you know, my presentation is coming in on a great time. We had some excellent talks from Judy, Dr. Gordon, and Dr. Hooper, who really stressed the point of early detection through comprehensive and regular eye exams. And as optometrists, being the ones that do the majority of that here in Canada, you know, and looking at the issue of, you know, what's the barriers? Why are we not doing as good of a job here in Canada when patients should be getting much more regular eye care? So I think Dr. Hooper gave a great overview of some of the conditions that are affecting the Canadian population nationwide when it comes to vision loss. I'm not going to go over all of them again, but because he did a great job. But like I said, myopia, those refractive errors, you know, not only a vision condition, but also high myopias that are nearsightedness to a high degree, you know, later on in life increases the risk of a lot of visual impairments. Diabetic retinopathy also on the rise, as was mentioned, and the fact that so many vision impairments and eye diseases disproportionately affect an older population. And in Canada, our population is aging. So from all aspects, you know, from birth to end stage, we really see an increase in vision conditions that could have long-lasting impacts. And thus the importance of a regular eye exam, because as was mentioned, I think over and over again already in this lecture, when we have that prevention and detect these things early, really a lot of that permanent sight loss can be avoided. So to look at why maybe there's those gaps in getting routine eye care from Canadians, we partnered with our colleagues over at the Canadian Ophthalmological Society to do a survey on access to vision health. And where over 2,000 Canadians were surveyed. The survey was done online and completed between June 10th and June 21st, 2022. Now, the questions that were asked in this survey did encompass a period of time over the past 2 years that did include several lockdowns and during the pandemic. So there are some aspects that are related to COVID-19, but nevertheless, it does give us a good idea of where these gaps may be when Canadians would like to access routine eye care. So overall, Canadians do consider their eyes important. You know, obviously 66% of Canadians are concerned about their eye health. We'd like that level to be a lot higher, but it does show that there is a certain amount of the population that does consider their eye care quite important. This is overrepresented in the age group of our seniors that show that they are a little bit more concerned than the average population, with about one in 5 Canadians expressing they're very concerned about their eye care. 41% of Canadians reported some type of change in their eye health or vision over the period of the last 2 years, with 19% of Canadians reporting some worsened eyesight. So these are the Canadians that are having issues that would regularly check in. So when a Canadian patient does have an issue or is noticing a change in their eyes or a worsening eyesight, are they able to easily get an appointment? And the answer is yes. So 79% of people reported that they got care when they wanted to get it. So, you know, when it's important to say like that this was when they felt they needed it. And, you know, there is some biased towards Caucasian Canadians and people over the age of 55. So there is some gaps there. But overall, getting access to primary care in a timely fashion is very achievable for many Canadians. So it's not that the fact that they can't come to see us as eye care professionals. And if we break that down even more so, our studies show that in terms of commute time for patients, most patients, over 3/4 of patients are able to get to their optometrist within a commute that takes less than 30 minutes. And a whopping 97% of Canadians able to get to their optometrist in a commute that's under an hour. Now, there's certain exceptions to that in Atlantic Canada and very rural areas. These times may be a little bit longer, but overall, it's not the distance between the patient and the optometrist that would cause a patient not to be able to see their optometrist. Likewise with delays and wait lists. So it's also important to recognize that that this study was done in those 2 years where there were certain even more delays due to lockdowns and reduced capacities of offices to see as many patients. But even during this time, 3/4 of patients reported that they had a very short delay of either immediately 66% of patients being able to see their optometrist within no delay, or a very short delay of less than 2 weeks, with many being able to see their optometrist in less than a month. Now, this can vary from clinic to clinic or region to region slightly, but overall, wait times to see an optometrist are not a barrier to those who want to get routine and regular eye care. So looking at the fact that Canadians do find their eyes important, optometrists and primary care is widely available. We're spread out to be close to our patients where commute times are rather low. So what are the barriers? Like we said, we're not getting that routine eye care done, and that routine and regular eye care is so vital for disease prevention. And what we see is really a widespread lack of awareness among Canadians regarding their eye health, and particularly to get their eyes checked even in the absence of seeing any noticeable change or visual symptom. So we see from the survey that the biggest factor reported for Canadians who didn't see an eye care provider in the last 24 months was that they didn't seek that care because they didn't think that there was anything wrong with their vision. Nothing changed. So this is really, the awareness is really the major barrier or bottleneck of why patients do not get regular eye exams, with affordability also being a factor. If we break that down even more, unsurprisingly, it's males aged 18 to 45 that report not being the least likely to see an eye care professional within that 2-year period. But that nothing wrong with my eyes is a factor all across ages in terms of why they didn't seek care. It's also a factor across all provinces and areas of Canada, showing high volume of nothing wrong with my vision or my eyes being uniform across provinces. So what can we do? This is a great area of collaboration and the importance of educational initiatives to make sure our patients know that even though they're not necessarily experiencing anything, like Dr. Hooper was mentioning, so many eye conditions start at a stage where there is no visual symptoms, glaucoma, diabetes, even early onset of macular degeneration, where we can detect early signs. There's not many visual or eye-related symptoms that a patient may feeling, but that early detection is so key. So making patients aware of the importance of regular and routine eye exams at all ages is really what we can come together and help promote, given that it's probably the biggest barrier of why we're seeing less patients than ideal seeking out routine eye care. So this could include public awareness campaigns. We at CAO put out 2 big ones per year bilingually across the nation through social media that promotes the importance of regular eye exams and the detection both of disease, but also in terms of enhancing eyesight. This was mentioned also, we do need to do a better job of communicating, not only amongst ourselves within the vision group and coordinating that, but also with other healthcare providers. pediatricians, family physicians, pharmacists, really getting that message out there on the key importance of routine eye care from our patients, practitioners across the board. Definitely, Judy mentioned all the great updates that we're seeing with Bill C-284 and all the good things that are in that bill. What's really encouraging also is that awareness of funding and support for getting that message out there about awareness and the importance of eye exams. So I'd like to thank everyone here again and everybody for putting this together. And it's really been a pleasure, and we'll be sticking around for the end for more questions as well. Thank you.
Okay. Thank you very much, Dr. Spiro. And I think that the fact that you actually did this survey in collaboration with the Canadian Ophthalmology Society is a wonderful thing, because in many countries you don't get that kind of collaboration between optometry and ophthalmology. And if we're going to make a dent on vision health in this country, all stakeholders need to collaborate, and this is a great example. And thank you for presenting those results. So moving on, I'd like to introduce next two speakers. You get two for the price of one here. The first speaker is Jennifer Jones, who is President and CEO of Fighting Blindness Canada. And going tandem with her on this presentation is Dr. Larissa Moniz, who is Director of Research and Mission Programs at Fighting Blindness Canada. Thank you very much to both of you for presenting the research aspect of vision health.
Thank you so much, Keith, for the introduction, and hello, everybody. I'm about 5 months into my role as President and CEO of Fighting Blindness Canada, and super pleased to be here on behalf of my team and the board of directors, our researchers, and of course, the vision loss community that we work with and we serve. For those of you who this may help, our slides are largely images, not so much content. We're going to be discussing all our key points, so you won't be missing anything. And Larissa and I are going to be trading off on slides, so you'll hear us share this presentation along the way. For those who know Fighting Blindness Canada, we offer education and information support to people impacted by vision loss. However, at our core, always has been and always will be, is investing in best-in-class vision research. In fact, we're the only organization in Canada that's dedicated to funding the best and most innovative vision research in the country, no matter where it resides, whether that's at universities or at hospitals. Anywhere where the talent exists, that's where we build our relationships. And that funding from our loyal donors has over 40 million has been invested in our time. The research that we've been a part of that ecosystem that we exist in, has provided treatment for age-related macular degeneration, drops that lower eye pressure for glaucoma, made cataract surgery an outpatient procedure, and recently, of course, Luxturna for a specific inherited retinal disease. It's a really exciting time that we're living in right now. In particular, and Larissa will speak more on this, but we're seeing advancements in new treatments all the time. It's from stem cell and gene editing to optogenetics and new drug therapies. The most advanced scientific breakthroughs in treating eye disease and restoring vision are now within reach. Larissa is now going to talk through the rest of the slides and research in much more detail.
Hello, can everybody hear me? I was having a hard time unmuting myself. So I'm going to keep talking unless somebody tells me I'm not unmuted.
You're good.
Perfect, thank you. Thank you for the thumbs up. So thank you, Jennifer, for that introduction. And our part of the presentation, it is a little bit different, speaking about research and the importance that research has in delivering that high quality eye care and treatments that Dr. Spiro and Dr. Hooper were talking about in the previous presentations. So I don't think I have to tell the audience this, but we really believe that research drives innovation. And this is all the way from basic science or discovery research to translational and clinical research, and even beyond that to understanding health systems and lived experience. So two examples that sort of came to mind when I was thinking about what is the path that research takes. The first one was looking at the genetic causes of eye disease. When Fighting Blindness Canada was founded about 49 years ago, it was thought that there were only actually a handful of genes that caused inherited retinal diseases. Now, looking forward through the decades, through research that Fighting Blindness Canada has funded, through research that has been funded in labs throughout the world, we know that there are over 300 genes that can cause an inherited retinal disease. And this research all came together and is now starting to drive new therapies, most notably, as Jennifer mentioned, gene-specific therapies such as Luxturna, but also many more that are in clinical trials. We also see really exciting creativity and innovation in bringing research to new treatments. One that I find really sort of fascinating was how anti-VEGFs, which are used to treat a number of eye diseases, including age-related macular degeneration, diabetic macular edema, it was originally discovered as, or used as, an oncology drug, and then was repurposed in the eye, and then with additional research trying to understand patient experience and improve outcomes, even more and better and longer lasting treatments are now coming on the market. And another exciting development that we will be talking about for years to come, I think, is how some of the first therapies for geographic atrophy have now been approved by the FDA. And none of this would be possible without research. And I think research as a whole, I am a scientist by training, so I really firmly believe that research funding is important. But once we have that research and that research has delivered new treatments, it is just as crucial that Canadians have equitable and timely access to them. So it really is a fundamental extension of the research we fund. And so access to me means a few things. First of all, it means access to treatments as early as possible. So that is clinical trials. So how do we bring more clinical trials to Canada? I think Canada often suffers, maybe possibly from being really close to one of the largest populations in the world, which is the United States, and not actually having as many clinical trials as maybe we would like for our populations. And clinical trials, they obviously bring us earlier access to treatments for Canadian patients, but I think in many cases, it's not only for those patients who are part of the clinical trials who benefit. It also brings us access to more expertise, to better equipment for the broader population as a whole. And once clinical trials happen in Canada, it can also often reduce the amount of time to getting a new treatment approved. So again, it's not just the few patients who have to be part of the trial that really benefit. It is the whole ecosystem. And I think access also means optimizing access. Looking at the health system in a holistic way, trying to understand how do we actually bring those treatments that have been delivered to all Canadians. And that includes access from sort of a physical point of view. How do we deliver it, for instance, to populations that maybe are in more rural areas, or for individuals who don't speak English as a first language? But it also means for our healthcare system as a whole. Are there ways that we can reduce costs or improve treatment planning or treatment delivery while also maintaining and improving outcomes? So overall, I think we all would agree that new treatments are really important, but they also don't mean much if you can't get to them. And a final aspect of research that I think comes into access is the idea of using real-world evidence to inform our continued treatment improvement and treatment planning. So this is patient-reported outcomes, identifying alternative outcomes that best reflect patient needs. So really looking at the whole continuum of research and how it leads to new treatments, but then also to better access. And I think I'm looking forward to, in the sort of second part of this talk, looking forward to discussing with the rest of the audience and the panel members about how we can work together to potentially even reduce some of the complexity of this access or approval process that we have in Canada. And finally, before I turn it back to Jennifer, I just want to talk a little bit about funding and funding for research. So I think, again, we would probably all agree that research is really important. But in Canada, I don't believe that the government has prioritized either eye health or eye research. It's really exciting hearing the Honorable Judy Scrow talking about how we are within striking distance of a commitment to a national eye care strategy. And as part of that strategy, I know at Fighting Blindness Canada, we will be asking the government to prioritize funding for vision health research. So as an example, the Canadian Institutes of Health Research, this is the largest public funding agency in the country for funding biological and medical research. If you adjust for inflation, funding through CIHR has essentially been flat since 2006. So there really hasn't been an increase in funding for our scientists. Something that is also, I think that gets to the heart of the lack of priority that eye health gets in Canada is that in Canada, we don't have a dedicated research table or research institute. Currently, it's, I think, a bit of an afterthought within the institutes for neurosciences, mental health, and addiction. And we can compare this to the United States, which has a dedicated institute, the National Eye Institute, which has about 2% of the total medical research budget is dedicated for eye research. So I'm going to turn it back to Jennifer to finish off, and I'm looking forward to further discussions.
Thanks, Larissa. 2024 for Fighting Blindness Canada is a pretty big year. It's our 50th anniversary, so we're going to be celebrating that in a variety of ways. And we're also going into our next 5-year strategic planning exercise. We're going to be engaging stakeholders from across Canada in consultations to inform that strategic planning. So I'll likely be extending an invitation to some of you on this call to participate in that. And where do we think we're going when we sit down and we imagine not just the next 5 years, but the next 50? What do we see fighting blindness becoming? Well, we definitely see ourselves continuing to be part of the advocacy conversation and a partner with our fellow vision loss organizations. We definitely want to deepen the relationships we have with Canadians in the vision loss communities and broaden to reach even more Canadians. So we do an even better job at serving those that we are built to be here for. But of course, research will continue to be at our core. And our hope is that as we create longer and lifelong relationships with those that we serve across Canada, that will translate into loyal donors, allowing us to invest even more in the education and information programming, as well as the core fundraising, core research. That is so much of what we do. Thank you for inviting us to speak today. I'm looking forward to the conversation and the Q&A at the end. Keith, I'll hand it back to you.
Thank you very much, Jennifer and Larissa, for enlightening us on the challenges and hopes of vision research. In fact, as you go through the discussion today, we presented a number of the challenges that we're facing, but I think in every talk there was a hope and a bright light at the end of the tunnel. And the ultimate bright light is the National Vision Health Plan that we've talked about so much. I'd like to move on and introduce Jennifer Urosevic, who's President and CEO of Vision Loss Rehabilitation Canada, who's going to give us perspective of vision loss rehabilitation. Before I say that, I'd like to just add one thing that maybe wasn't too obvious in the National Vision Health bill that Judy's been talking about does include rehabilitation. And it's wonderful for rehabilitation to be included as part of the spectrum of vision loss, ranging from diagnosis through to treatment and rehabilitation. With that, I'll pass it on to you.
Thank you, Keith. And it is very exciting. We had Judy come and speak at our recent AGM, and to think back to 25 years ago when I got into the field of vision rehabilitation, it wasn't a priority around health, and it sure would have been part of a national vision health strategy as well. And so it's great to be here, and a big thank you to the CCB for the invitation to speak. And I'm going to speak a little bit about the future and what we can imagine into the future related to vision rehabilitation. One of the things that a client a long time ago, or maybe not so long ago, told me that has really always stuck with me. And I think it's really relevant as we talked about today, early detection, primary care, vision health, the research to continue to ensure that we are looking at best practices, is that blindness and low vision is not necessarily life-threatening, but it is life-changing. And when somebody receives the diagnosis, and could be through treatment as well, there are impacts that are affecting their daily life. And when those impacts are impeding on somebody's ability to live the life that they want, we're here to help. And so those who know about our services, we provide vision rehabilitation. Those who don't know about our services, vision rehabilitation services across Canada, in every province except for the province of Quebec, and in the territories as well. When I think about the topic of what does integrated vision rehabilitation look like in the future, there are some really strong models in Canada and worldwide, but there are some specific components that I think we could all come together and really work. And it is, and I think it was Dr. Hooper who said it right from the beginning, is around collaboration and communication. And I think that over the last couple of years, as we've been advocating and standing behind and coming together as a vision loss community, we have started to have some really important conversations. So I'm going to just share some thoughts. We are in the midst of our strategic planning, which will launch in our next fiscal year in April. And so we've been spending a lot of time talking to partners and stakeholders and our clients and our staff about the future. And some of the common themes that I'm going to talk about are things that we are hearing firsthand, things that we've learned along our journey as well. And I think for the most important piece really is client-centered care. And our clients are telling us that they want to be equal partners, or their family members, their community around them want to be part of what the care looks like, what their rehab journey looks like, how they receive services. They want to make informed decisions about their rehab journey and the goals that they want to establish, and the pathways to be independent and live an independent life. One of the things when I think about client-centered care, and to really truly do this in a really important way, is that we need to really put the client at the center of a wheel, essentially, and all of the spokes are a lot of us on this call and our community, and making sure that to get that wheel to turn, that we are connecting, we are collaborating, and we are communicating together. And so an integrated model of care would be a multidisciplinary team that would involve ophthalmology and optometry and opticians, vision rehabilitation specialists, orientation and mobility specialists, low vision therapists, occupational therapists, and social work. I know I'm probably missing some key components, but to make that wheel and know that each of our clients coming to us have different experiences as well, that is going to take a very individual care plan. One of the things that we do in our organization to help clients navigate not only the goals that they have internally for us, but also other resources out in the community. We are one part of their journey. So it could be within their own community and the social recreational programs that they want to access. It could be travel to employment and different things. That there are many aspects to that journey that the continuum of learning and developing is so critical. I believe earlier, and I think Larissa just spoke a little bit around access from a research, and we talked a little bit earlier also about access to eye care. And I think it goes to a little step further when I think about it from the perspective of an integrated care model, is that people want their care closer to home. And I was really impressed with the slide that said that most optometry and primary vision care, people didn't have to travel more than 30 minutes to that appointment. I think that that's, again, another really important element as we look at building our future workforce as well, is how do we find that right balance to deliver that care closer to people's homes, but also in the format that they want. So through the pandemic and post-pandemic, we were able to pivot very quickly to some virtual programs. Not all of the vision rehab services that we provide can be done safely from a virtual place, but finding that right balance of some of those reinforcement techniques and some of the technology that would really leverage that really does help to build that integrated care. So I think about how we can remove barriers, really looking uniquely at the client's social position. So whether that's their geographical location, socioeconomic status, cultural background, it's really important to take a look at all of those barriers and who are the people that we're not able to reach, and how can we collectively work together to reach more people. And so how can we build in, and I think an important part of this integrated model is how do we share knowledge? We all have expertise in different areas that help to contribute to that, but how do we share some of the basic knowledge that when we're going in, we're speaking with one common voice and one common vision of how we can support our clients. Training and the reinforcement of when somebody has an assessment and they're provided with a device, how critical it is for that long-term success of utilizing assistive technology is the training that goes into that. Or for somebody who is learning, how to navigate their world again, the critical pieces of being able to have quick access and ongoing support so that those skills up front can be developed and nurtured so that long-term are transferable to other new situations. I think one of the pieces that I didn't speak out, but probably is one of the critical areas that is probably at the beginning of a rehab journey is that emotional support. Like I said, when this client used this term with me of what a life-changing experience it is, how important it was for them to have somebody who understood their journey, somebody that they could receive counseling from, and how critical that part of the integrated part of their journey was. Sometimes it is having somebody there to help navigate the tough decisions about giving up a driver's license, transitioning to a white cane, and then different transitions throughout their journey as well. A couple of things that I think that builds this, not just to the services that we would provide, but the broader community and broader reach. When we talk more about the impacts of blindness and low vision on somebody's daily life, how can we empower somebody to take a look at holistically what that means and how they interact in their community and how we want to integrate into daily activities that they've always participated in. And so that's where it goes back to that really unique individual care plan that may look different for each of our clients coming to us. And then looking at really the integrated care model and evaluating and creating Canadian best practices. There are best practices that, of course, are established, and we communicate internationally with our counterparts all over the world to look at, how we measure the outcome of our services, how many units of service we provide in order to achieve different outcomes. But we also need to start really focusing on the long-term impacts as well. And so I think in the future of looking at this integrated vision rehabilitation model, we really need to align research and evaluation as part of that so that we can continuously improve how we deliver services and the impacts, I would say, also of emerging and future technologies in there. There has been, and I think that this will definitely continue with the Bill C-284, advocacy and policy that supports and helps to reach those who we're not reaching. And so that it removes the stigma of this is scary, so I'm going to avoid it, and puts out front that there are supports and things that can be done to help people live, again, the life that they choose as well. 4 themes that have sort of come out of our strategic plan as I get really excited about where we're going to head into the future over the next 4 years really is around collaboration, communication, connections, consistency across Canada. Wouldn't it be really nice to have a consistent approach to how we integrate vision rehabilitation into the continuum of care? It's big ambition, but I do believe that as we move forward, and I know we still have a long road to go to get to some of those things, but at the end of the day, when we have an integrated model of care, our clients are the ones that benefit the most. So as I wrap up, I'd like to also extend my thank you to the Honorable Judy Scroggs for her support and guidance and support, as well as my colleagues from across the country who continue to help to advocate for a national vision health strategy. Thank you.
Well, thank you very much, Jennifer. I don't think anybody could be doing as much to promote the integration of vision rehabilitation into the continuum of care than you, and it's wonderful to hear about it. So thank you very much. With that, I'd like to move on to the questions and answers. We have a number of questions that have been put in the chat box that have been passed on to me, and I'm going to take them and pass them on to panelists in no particular order. First of all, let me reiterate how to ask a question. Basically, you can go to the chat icon at the bottom of your screen, and I had a comment that this is not particularly accessible. I always thought it was. If you have a problem, then just send us an email and we'll get an answer to you by email after the meeting. Okay, so moving on to the questions. Okay, first question I can handle quite easily. It's an attendee asked, will a recording of this be available at a later time? The answer to that is yes. It should be available within a day or 2 at the very most. It will be available on YouTube, and we will be sending out a link to the YouTube recording to all participants. And if you don't get that by email, that link is also available at the CCB National website, which is www.ccbnational.net. That's www.ccbnational.net, where you will get a link to this meeting, and you will also get a link to the latest issue of White Cane magazine, which we are very proud of, and would love you to read it, and all sorts of interesting things in there if you haven't already read it. The next question is basically also for me. I'm wondering if there is a provincial breakdown of the report card data that I can present to my colleagues on the Premier's Council for the Status of Persons with Disabilities in Alberta. The report card has very little provincial data in it. There is provincial wait times data, surgical wait time data, which you can find in there. But there is quite a bit of provincial data in the cost of vision loss study, which is also available at the CCB National website, www.ccbnational.net. So I suggest you go into the cost of vision loss to get the kind of data that you might need for your disability council. We would love to see that kind of data emerge at that kind of a venue. But the report card itself is fairly limited. Okay, the next question says, shocking statistic concerning R&D investment and the fact that it's less than 2019, accounting for inflation. What can we as a community do to prioritize and fund vision health and accessibility related to the management of eye disease? What provincial governments are closer to prioritizing it? So I guess this question is not only R&D. I guess it's primarily, what can we do to get more R&D funding? But then it's also, how do we get provinces involved in funding vision health and accessibility related to the management of eye disease? So I'd like to start off with Dr. Moniz, who can talk about, or Jennifer Jones, whichever one of you wants to take the question, on how do we increase R&D funding. And then I'd like to pass it on to the other participants for their comment on how do we get provinces to prioritize vision health. Jennifer, or
I think, yeah, thank you, Keith. I'll take the first part of that because I think there's two parts of it. One is there's the philanthropy that we have a little bit more influence and control over, and then there's the advocacy around government funding. And so I'll perhaps leave that to Larissa because she's a little closer to it than I am. But one of our ambitions is to certainly increase our top line revenue so we can invest in more cutting edge research. And we have some different ideas that we're percolating right now, but that's what we're going to be bringing to the table next year as part of our strategic planning exercise. And we'll be doing that with consultation across stakeholders. But for us, the backbone of our ability to invest in research is because of our philanthropists across Canada. And that's everyone from people giving, significant gifts of, 50,000, 100,000 plus, as well as those who are giving us $10 a month. And no matter how small the dollar is, everything counts, and it makes a magnificent difference in our ability to invest in research projects, not just on a one-off, but on an ongoing basis, so we can really see how we're moving the needle over time. And we're building relationships with researchers in different institutions, both domestically and internationally, to identify where's the greatest opportunity for our dollar or our investment to make a difference. And so that's one of our biggest focuses is how do we cast a wider net so we can deepen and broaden relationships with people who are closest to this cause and really believe in the work that we're doing, so we can generate even more support that will in turn allow us to invest in more research. From that more of an advocacy standpoint, I'm going to hand that off to Larissa.
Yeah, I think, thank you, Jennifer. I think from a sort of a national level, something that is really key is something like the National Eye Care Strategy. So making sure that the government sees eye care as a priority. So I think it's really hard without that being the case for the government to sort of want to invest in research. And I think even broader is creating a good ecosystem in Canada for R&D at all levels. So is there a good ecosystem for industry sponsored research? Is there a good way for researchers in Canada to translate their research into preclinical or clinical research? Are they having the support they need? I think a lot of those systems, they are growing in Canada, but they aren't quite as strong as they are in other parts of the country. So it really takes work at a provincial level, but also at a national level to make that possible.
Okay, thank you very much, Larissa. Dr. Hooper or Dr. Spiro, would you like to comment on how we get provincial governments to get more interested in vision health? Or if you want to comment on the research question as well, please feel free.
I can, sorry, I've shrunk. I can have a go at provincial governments. They're a tough nut to crack because at least in Ontario, where I'm most familiar, they're focused on numbers and wait time and getting the backlog of surgery through. The nuances around new treatments and the log jams that we face in terms of getting new treatments approved, as was mentioned earlier, that's a significant issue because we have a federal approval process, then we have provincial approval processes, and then after it's approved, then it goes through another process to determine if it's actually going to be fundable. And so I'm sort of rambling on in terms of what the problems are. Are there solutions? I'm hopeful that if we, I hope that if the bill passes federally, that will have a bit of a trickle-down effect, that we can approach the provinces and say, hey, the federal government has a desire to have a coordinated approach. Healthcare is largely delivered by the provinces. How can we get on board with this and move things forward? I'm not perhaps as optimistic about this as I was at the end of my talk, as you noticed.
Okay, thanks. No, I think that's a really good point that you make about the linking of the national strategy to the provincial strategy, because that's going to be our next layer of advocacy. Once we get that national plan, we then have to go to province by province, territory by territory, and try to get some adoption at that level. Dr. Spiro, do you have anything to add to this? Or
yeah, I think Dr. Hubler's done that well in terms of research, and I would say, attaching funding to public awareness is always great as well. Just to give an example, in the province where I'm from, Quebec, where we had an initiative regarding school children being able to access funding for glasses or contacts every 2 years. That was, even though that was funding for that, there was a huge public awareness campaign that came with children's eye care that was part of that package as well. So it's about also getting that message out to the public about the importance. And I think from the grassroots, with us in the community, knocking on doors, but also supporting that federal national strategy on vision care, so that we could also have possibly the federal government putting a little bit of pressure on provinces as well. So hopefully coming at it from both of those angles, with making sure that we're getting that message out to the public as well, I think is a great kind of strategy to be the tide that raises all boats, whether it be getting primary eye care done, increasing access to surgical interventions or new interventions or drugs, or even just bolstering up research. So yeah, it's like it was said, it's a little bit of a tough nut to crack, but I do think with the efforts that we're putting in, at both ends, hopefully we can move the dial. And I think this is a really encouraging and exciting stage that this community is in right now.
Okay, thank you very much, Dr. Spiro. The next 3 questions are all for Dr. Hooper. Dr. Hooper, when you look ahead 5 to 10 years, what vision health advances do you think hold good promise?
I think in the short term, we're going to have drugs that effectively slow the progression of geographic atrophy, which will have a huge effect on keeping people functioning in their homes and enjoying the quality of life. I think the other thing in tandem with that is going to be an understanding of much better understanding of what's going on with glaucoma at the optic nerve level, and being able to address the neuropathy as opposed to just the pressure, because everything we do now is predicated on lowering the pressure, but that's really only part of the process. And I think we're very close in terms of research to getting there. I think the other thing is that corneal grafting, in terms of actually being able to genetically, or it's probably not the correct term, but to tissue engineer acceptable corneal substrates that don't involve needing to have somebody donate tissue will really be an advance. And I think we'll be seeing that as well in the next 5 years.
Fantastic. Thank you. The next question was actually put to Dr. Hooper, but I'd like to extend it to Dr. Spiro as well. It says, does Canada have enough eye care professionals today or tomorrow, ophthalmologists or optometrists? Dr. Hooper, would you like to reply to that?
If we look at the current paradigms of care, there are significant shortages, and the shortages are not the same throughout the country. Atlantic Canada has much more of an issue than does downtown Toronto or the GTA. That is something that we are aware of and are trying to address. I think there's a big opportunity here with the number of new medical school spots that have been announced right across the country. Ophthalmology hasn't increased its training program size literally for decades. And I think this is an opportunity as training spots follow the trainees to hopefully lobby to get more positions. And I think as well, some of the improvements of the ability to assess foreign credentials and move people into the workplace will help as well.
Okay. Dr. Spiro, would you like to address the optometry aspect?
Yeah, sure. Great question. And, from our surveys and results, looking at how many optometrists are practicing and population needs, we're actually doing quite well in optometry. I think that was evident by the fact that, in the slides that I presented, we're close by within 30 minutes, and wait times, even during, when things were a little bit less accessible, that we were still able to see patients within a month. That said, it's not all rosy. Even though we do have enough optometrists for the population, we do have some distribution issues where there are certain regions that are a little bit less served, particularly extreme rural, as well certain parts of Atlantic Canada. So it's also about making sure when we're training optometrists that they realize the opportunities there are to practice in a little bit more rural settings across Canada. But generally, we do have a nice population to optometrist ratio.
Okay, thank you very much, Dr. Spiro. The next question is for Dr. Hooper. How does COS address the progression of myopia in children, as it is a great prevention tactic for pathologies linked to high myopia in older adults?
I think, and I'd be interested in Martin Spiro's thoughts as well, Dr. Spiro, but I think we're in a situation where the public, at least the parents, aren't recognizing the dangers of prolonged screen time in children. And there were studies that looked at how much screen time increased over the pandemic. And even now, as one-on-one teaching is still not fully engaged, there's a lot more screen time and use. So I think a strong educational component as to the danger, what to do about it, I think is making people aware that children need to spend time outdoors every day, and again, an educational campaign.
There is data that shows that there's less myopia in kids that spend time outdoors. And it's not just that they're away from screens. Dr. Spiro, sorry.
Yeah, no, it's a great point there. No, it's part of getting that when we see kids for primary care, we're looking even at an early age, are their parents myopic? We're asking questions in our optometry offices, what activities is the child doing? Are they, excessively on a screen, and making sure that those recommendations are being set. The CAO joined a global coalition, the Global Myopia Awareness Coalition, that includes the International Association of Prevention of Blindness, the IAPB, the World Society of Pediatric Ophthalmology and Strabismus, along with the World Council of Optometry and industry groups, really to create that awareness about myopia and the options available. There's more and more research showing really the effectiveness of different types of interventions, including types of spectacle interventions, contact lens type intervention, and pharmacological interventions that if the candidate is chosen properly at the right age, can help slow down the progression of myopia as well. So it's taking the environment into account, the early detection, the treatment options available, and measuring the progression of myopia. So more and more in optometry offices, we're seeing not only measuring the degree of myopia, but many offices are now equipped with axial length machines, so a machine that measures the size of the eye. As the myopia increases, the length of the eye tends to get longer and longer, and it's the effect of the eye getting longer, which is really the driver of future vision and eye disease, such as retinal detachment, myopic maculopathy, glaucoma, etc. So by able to see which children are a little bit more at risk, we're able to intervene a little bit earlier, discuss treatment option, and visual hygiene recommendations, such as getting outside, using screens in a proper way, and following those as needed.
Great, thank you very much. The next question is for you, Dr. Spiro. Don't turn your video off so quickly. Dr. Spiro, is there such a thing as a family guideline by age for optimum eye examinations as there is for medical and dental care?
Yes, we do have that actually on our website at the Canadian Association of Optometrists website, on the frequency guidelines as well. So during we do recommend an eye exam at the age of 6 months, at 3.5 years, and yearly at the school age up until 18, and then through adulthood an eye exam every 2 years, and then over 65 a routine eye exam every year as well. Now, obviously, this is a general guideline for population, but when you see the optometrist, given a condition or risk of a condition, they may alter that, either shorten it or see that, patient maybe is even less at risk. It could be even lengthened a little bit. So you may get a little bit of a longer timeline. So these plans, need to be taken on the population level as a whole, and as a good recommendation, but ideally sticking to what the optometrist recommends generally. Now, if you haven't had any specific type of recommendation, then definitely adhering to the frequency guidelines on the Canadian Association of Optometrists website is really a best way to make sure that routine and regular eye care are being taken advantage of.
Okay, thank you very much. The next question, I'm not sure that anybody on the panel is able to answer specifically, but I'd like to generalize the question. The question is, both Syfovre and Izervay have been approved by the FDA. Why the delay in Canada, and when can we expect approval for these two innovative eye drugs? Okay, so I'm not sure that any of us know anything specifically about those particular drugs, but I think we need to, I would like to throw it out to the panel to address the whole issue of, do drugs take longer to get approved in Canada, and if so, why, and is there anything we can do about it? Larissa, would you like to take a...
I will take a first stab at it, and I'm sure you have some thoughts of your own, Keith, about it. So I think drugs definitely come to Canada later than they do to other markets. So drug companies will normally start with some of the larger markets, which is the United States, which is the FDA, or the in Europe, so with the EMA. So they like definitively do get put forward for approval later in Canada. There's also the reality that we do have a smaller population size. I do think that makes it a little bit harder to say that, to understand what we could do to change that fact. But I do think once the drug starts to get approved in Canada, there are definitely many, many layers and steps that a drug has to go through that don't happen quite as much in other countries. So there is Health Canada, there's Cadatharines, then there's the price negotiation that each province has to negotiate themselves to get it on the formulary. So I think there are definitely a much more complicated process by which drugs get approved here, which I can definitely imagine that makes some companies less willing to put it forward first, but then also even when they decide to put forward the drug for approval, Canadian patients are waiting for months or years for a drug to get approved. And I think a lot of that just has to do with too many layers of decision making. I think that's really up to the federal government and the provincial governments to come together and try to find a more streamlined solution. They are talking about it already, and they have made some changes in the past few years with having like a pan-provincial, like the PCPA, the pan-provincial negotiation, but it really isn't enough, I don't think. So I would say, yes, it does take longer here. And there's sort of many reasons, some of which we can't control, which is our population size, but some of which I think we can control.
I would argue actually that the part of the reason is that what's taking a length of time is the reimbursement component. You know, the FDA may approve it, but they're not approving it for reimbursement. They're approving it for safety and efficacy. So, you know, people are going to be paying for that drug, so you don't need to go through a reimbursement process. So that's taking a long time. Nevertheless, Health Canada does generally take longer than the FDA to approve drugs. Next question. The question is, it was mentioned in the report card that a percentage of eye healthcare professionals are leaving their jobs post-pandemic. Were there reasons provided, or would you be able to elaborate on this, please? Since I dug up that data, it was a survey conducted by Statistics Canada, and they didn't ask for reasons. It was just the different kinds of professionals and the question of where they're going to be leaving their jobs. So there isn't an answer to your question, I'm afraid. The next question is, where can we find the report card? And I think I've already mentioned that. It's www.ccbnational.net. Okay, next question is, do healthcare professionals receive training on eye care conditions and how to care for people with these conditions? I'm not sure what they mean by healthcare professionals, but I guess it means everything from a GP to physiotherapist, I suppose. Dr. Hooper or Dr. Spiro, would you like to comment on that?
They do receive training as part of medical school in terms of physicians. So that would cover off endocrinologists, family physicians, and pediatricians. I think the issue is that the emphasis on it and the length of time that the training occurs is suboptimal. So I think they recognize that there is a need for eye health care, but I don't think it's top of mind in many cases.
The next question is actually a comment. Maybe Jennifer can comment on it as well. It says there are also remarkable shortages of vision rehabilitation professionals, including O&M specialists, low vision therapists, and vision rehabilitation therapists. Would you like to comment on that, Jen?
I sure would. Absolutely. In Canada, there's only 2 postgrad programs, so it's very difficult for us to hire, and there's not as many people going into the field. So that is definitely part of our advocacy strategy with the universities.
Okay. Thank you. Thank you very much, Jim. There are a couple of questions that have been added since I thought we were coming to the bottom. For Dr. Larissa Moniz, are we losing scientists to other countries because there is not enough funded research projects in Canada to engage their expertise? A good question.
I think this is like a constant concern for scientists in Canada, that we've got a brain drain going to other countries. I think one area where there is some evidence that that we are losing scientists is actually at the trainee level. So at the trainee level, which is PhD students and postdocs and master's students, the level of funding that CIHR or NSERC or the other agencies give hasn't really increased in decades. I was looking at this before, and I don't think it's actually increased since I did my PhD, which was many, many years ago. And so I think there is evidence that like top rank students are choosing to go to the States to pursue their PhDs or postdocs. And I think as soon as you lose people at that level, the chance of them coming back to Canada is lower. In terms of at a professor level, I don't have any evidence that that is the case. I would imagine that has to be the case if it's such a tough funding environment that whether people are leaving Canada to go to the States, that's one option, or whether they're leaving academic science altogether, I think that might be just as much a concern, because they don't have the funding to maintain independent research labs.
Okay. Well, I think that's the end of the list. Having gone through questions from the audience, I'd like to come back to the panel and ask each of you if you'd like to sum up with a very short sum up, or some of the questions you've heard, or things that you think we haven't addressed or should be addressing. Can I go to each of you individually and see if you want to say anything? If you don't feel that you have to. Start off with Dr. Hooper.
I think it has been very helpful. One of the recurring themes that has been talked about right throughout all of the discussion is the need for coordination and care, and the need for better education of the population, that they need to have regular eye examinations. And I think if we do those two things, we can certainly improve the state of eye health in the country significantly. I'm hopeful that the bill that's before the federal government will pass, and I'm hopeful that it acts as a bit of a catalyst to get things moving at other levels. We are really facing a significant challenge, I think, in the next 5 years. There's, as I'd mentioned, lots of treatments out there that are really going to revolutionize care, but they all come at a cost. And the price tag on some of them is eye-popping for a federal finance minister or for a provincial finance minister. And how that gets reconciled with the benefits to the population, I think, is our job to, at all levels, to make very clear.
Thank you very much, Dr. Hooper. Dr. Spiro, do you?
Yeah, I think a lot has been already said, and I don't want to repeat anything. I would just like to say how also, I think this collaboration is great, and I think all of us working together is really going to be a push to make these things possible. So thank you for organizing this and getting everybody here, and giving these opportunities to discuss these things among the various stakeholders in the vision care world. So I think that's really important, and I look forward to continuing that on. So thank you very much.
Thank you very much, Dr. Spiro. I'd like to pick up on what you just said. If it's not already obvious, a lot of the studies that I was talking about have all been collaborations between the Fighting Blindness Canada, Canadian Council of the Blind, CNIB in some cases, and the Canadian Ophthalmology Society and Canadian Association of Optometry. So it's been a wonderful collaboration of all stakeholders. And like everything else, if we we're all in this together, and if we carry it out together, we hopefully will continue to make headway. So thanks for mentioning that. Jennifer Jones, do you have anything you would like to say?
I think without taking too much airtime, Keith, you basically summed up what I was thinking when I was, especially since I'm new to this sector, I was listening to the questions and trying to understand, how they represent maybe a lot of other people across Canada. And it really comes down to advocacy, which can be defined in a lot of different ways. It can be defined really about the relationship with government and applying, influence or pressure to move them in a direction around policy. And I think that would speak to what we've covered here around access to, vision, eye care, having a national desk, imparting the importance of Canadians being, going in for regular checkups. Certainly keeping talent in this country around to ensure that there's a pipeline of researchers that are going to be within our borders for a very long time, continuing to invest in research and making sure that's really important, but then also advocating for the work we're doing with Canadians so that we get their support too. So I think advocacy for me becomes really the bullseye of the work that we do, and all those different conversations are the prongs of which, all roads lead back to partnership and collaboration, and making sure we have a common vision for how we all need to move forward to benefit the sector.
Okay, thank you very much. Larissa Moniz, do you have anything to add to that?
Yeah, just briefly, I would say it was really nice seeing all of us, exactly as Jennifer said, coming together with our different sort of viewpoints. And of course, we all agree that everybody else's interest is also really important, but it was nice hearing sort of the breadth of work that's taking place in this sector, both in terms of eye healthcare, but also in advocacy. And I'm seeing sort of that united voice trying to move a common goal forward. I think that's really wonderful to see.
Thanks, Larissa. And Jennifer Jurosevic.
Yeah, I won't repeat anything that's been said. Agreed. I'm calling in today on the Zoom call from our most eastern province, Newfoundland, and the gaps that were spoke about earlier in healthcare or in eye care, and really the sectors around having qualified people working in the field is a really important factor, and I'm grateful that the bill includes rehabilitation, and that the future is bright because we are all collaborating together.
Okay, thanks very much, Jen. Okay, well, thank you everybody for your great contributions today. I didn't pass it on, but there were a few comments in the chat line from people who said that they thought it was a great session, and hopefully the several hundred people that were here today all felt the same. With that, I'll pass it on back to Michael Balajan.
Thank you very much, Keith, and an outstanding job as moderator today. I would also like to thank personally, on behalf of the Canadian Council of the Blind, Jennifer Jones, Larissa Moniz, Dr. Spiro, Dr. Hooper, Jennifer Jurosevic. I didn't forget anybody, did I? Because I usually do. Anyways, I would like to thank you for outstanding your outstanding voices, and the fact that you were here today, and we were collaborating for the best interest of vision health and the people with the vision loss community. With that, I'd like to thank again our sponsors. Again, take this opportunity to thank today's presenting sponsors. We couldn't do this without you. And together we're working to change what it means to be blind. And it's important. Again, thank you. Thank you for joining us today. This is our final event of 2023. It's been a great year, and it's been a pleasure to work with all of you this past year. We look forward to seeing you next February during White Cane Week 2024 as the Canadian Council of the Blind celebrates its 80th anniversary. Thank you and good evening.